Communication covers a really broad range of elements that we all use every day when we're communicating with other people. So the first one we're going to talk about is speech. So speech includes how you're pronouncing sounds in a word and how that translates to speaking face-to-face to someone versus on the phone, or depending on your work requirements, speaking to a large group of people. So how you use your speech in each of those situations, you could have difficulties with. And the next one is language. Language includes understanding what's said to you, thinking of what words you want to say, can you understand what you read, and also are you able to write? So they're the four main elements of language that people can have difficulty with. The next one is social communication. So that includes how you interpret the social rules that we have every day. Do you know how to take turns in a conversation? Can you read someone's body language or their facial expression? And do you know how to end a conversation or when to move on to the next topic? So all those things fall under social communication and can be sort of subtle and harder to pick up on sometimes. And the last one we have is voice. So how we use our voice, how our voice sounds, and it often links in with speech as a part of speech, and can also include people who have jobs that require a lot of talking, like teachers, so people that are quite prone to having voice problems. When you're talking to your clients, there are lots of different things that encompass communication, so there's lots of things to watch out for and ask about. So some broad questions that might make you think that someone might need to see a speech pathologist for their communication are asking them, are they understanding when someone's speaking to them? And are they understanding in different situations? So they might understand what someone's saying to them when it's, someone that knows them well versus when they're receiving, higher level information, like at a doctor's appointment or at work, for example. So checking in those different environments, are they able to understand what people are saying to them? Secondly, speaking. So this covers both speech, voice, and their expressive language. So, do other people understand their speech when they're talking? Do they ever lose their voice or have changes to their voice when they're speaking? And can they think of the words that they want to say? And are they able to express themselves the way they'd like to? The next one is writing. Are they able to do the writing they need to function every day? So can they write a shopping list? Can they write in the calendar or in a diary? Or can they write a letter or a card? Looking at these different levels of writing from basic to the more complex, and are people able to do what they need to do? And the next one is memory and thinking and how that relates to communication. So our communication is a part of our sort of broader thinking skills, and speech pathologists can also work with people that might have problems with their memory or planning and thinking skills, and they can assist them with working on memory tools like a diary or a calendar and things that also require communication and written language to help them. So if any of your clients are having trouble with any of these broad range of things, they could benefit from seeing a speech pathologist. And communication difficulties are far more prevalent than people realise. So 30% of people that have had a stroke might have difficulty communicating, and up to 85% of people with Parkinson's might have changes to their speech, their voice, or their swallowing. So there are lots of people out there that could benefit from seeing a speech pathologist. And the other thing to consider is that even a mild impairment in communication can have huge impacts for someone's day-to-day life, particularly if someone's looking to volunteer or work or communicate at that higher level, then they could really benefit from speech pathology support to achieve those goals.